As we try to understand what digital health is, it's important to try to understand what key technologies are changing and are driving the digital health revolution that I think we will see in the coming years. One recent formulation in a Mayo Clinic proceeding paper was focused really on internet and mobile devices. As you can see, in this formulation, there's a key focus on telemedicine, web-based strategies, electronic communications of all sorts, and monitoring sensors. Those are important changes, but as we will see in coming slides and coming presentations, there's a variety of different technological changes that will fundamentally change the healthcare system. And while mobile health or mHealth is certainly part of digital health, it certainly isn't the exclusive way that digital health will be adopted and presented globally. In other words, that formulation of technology probably isn't broad enough because digital health is broader than simply the use of mobile or mHealth. So when we talk about digital health, what we're really saying is we're looking at the traditional healthcare system and we're trying to decrease costs and inefficiencies, reduce errors, and improve outcomes through a variety of different actions. Obviously, increasing data flows and analyzing more data by adding new devices and technologies is an important piece of digital health, but so is increasing the chances and potential for behavioral health changes to improve outcomes using just-in-time data as well as deeper analytics. There's also a core piece of this that isn't specifically related to mobile or connectivity, and that is using new technologies to deliver new, potentially more personalized treatments. That certainly may use data that we gather through a variety of sensors, but that technology is more than just mobile technology. One of the other issues you see is, are we potentially decreasing the role of humans in diagnostic and treatments? And I think the answer is yes for a variety of reasons, not the least of which is robotics and nanotechnology, in addition to the use of AI and big data. One of the other pieces of digital health that's core is really increasing accessibility to healthcare. So we're able to deliver healthcare in new and different ways, and in new ways that actually expand the number of people that get it, both due to cost reductions, but also mobility. And finally, we will be expanding the areas where healthcare will be delivered. I may be able to get much of my healthcare sitting in my living room in the future, whether that is through that is for diagnostic purposes as well as treatment purposes. One of the other key pieces of digital health is that individuals can use digital health to better manage and track their health and wellness related activities. So what that means is, in addition to having a revolution of how providers give us care, the individual will really have more ability to gain control and gain data regarding their own care and have insight into themselves. One of the key drivers of adoption of digital health, apart from technology, is the costs associated with healthcare globally. As you can see here, in the EU, healthcare was 7.2% of GDP in 2010, and the projections are that it will be 8.5% of GDP in 2060, according to the eHealth Action Plan. In the United States, health spending typically runs higher than that, and in fact was almost 18% of GDP in 2016. So there's a clear cost control mandate that eHealth and digital health really can try to fix, and that is one of the key things in understanding one of the key drivers of digital health. The EU has come up with its own formulation of digital health and frankly what it should try to accomplish. And as you can see here, the first point obviously is to help improve the prevention and management of chronic disease and multimorbidity management. Obviously the core focus there is to improve healthcare outcomes. Another key part is really increase the efficiency and sustainability of health systems. So we're looking at how efficient are they, how do we reduce costs by using innovation, and also focusing on the patient, if you will, here, and empowering individuals to probably have more control over their health care, which is a key part of this, obviously beyond just from the provider of healthcare side. Interestingly, there's a focus on cross-border healthcare, health security, solidarity and equity, as well as improving legal and market conditions for developing e-health products and services. And that's one of the things that runs through concerns over digital health at this point, as we'll see, is concern that there's not perceived to be a sufficient ROI and a perception that there are legal barriers that would preclude digital health from really becoming as fulsome as it could be. The FDA has also offered its view about key issues with digital health, and those include wireless medical devices and mobile medical apps. Health IT, telemedicine are also key issues. Medical device data systems, interoperability for all of those systems is a critical point that we'll talk about in the future. Software as a medical device, general wellness, and of course cybersecurity. Those are really key issues that I think cut across any jurisdiction, but the FDA has done a good job of sort of summarizing the key issues from their perspective and setting them up so we can examine those in the future as we look at digital health as it continues to grow. The EU has also offered its perspective on, frankly, barriers to the adoption of digital health as we see here, and I think these are common issues across borders. A lack of awareness and confidence in e-health solutions among, frankly, all key stakeholders, whether those are patients, citizens generally, as well as healthcare professionals. A lack of interoperability between e-health solutions, so it's great to have new devices, but if they don't talk to each other in a language they all understand, you can't unlock the same value. And we dealt with this a little bit in the US when HIPAA came into being. HIPAA is not a privacy law, it's a healthcare interoperability and portability law that happens to have privacy and security components to it. So we've seen this before in the US, and we certainly haven't solved it, but we've been thinking about these issues for a while, and part of the implementation of electronic health records, or EHRs, has been really focused on that interoperability point, because you do have to have these systems talking to each other and communicating the language that all of them understand. One of the main economic challenges is there is not a lot of evidence about ROI and cost reduction with e-health tools are used, and so there's a hesitancy among some in the healthcare industry to start spending significant sums to adopt these tools without understanding that there will be savings that justify it on the back end for them and efficiencies that they can unlock. There's also a lack of legal clarity around a lot of these issues, including when things are covered by HIPAA and when they're not, when the FDA is relevant to an inquiry or not, and that just adds challenges. Obviously, we have those same challenges in the EU as the EU recognized, and we see that issue really coming forward in the next bullet point, which is inadequate or fragmented legal frameworks, including regarding reimbursement, but privacy and security are certainly issues there. There are questions about how these changes due to digital health will be billed under existing systems, and I think there's a lack of clarity around that as noted here as well. There are high costs to obviously setting up some of these systems, and that is a barrier, particularly when we don't have the ROI track record to show it. And there's obviously regional differences in play here, and frankly, where the cost cannot be absorbed by regional clinics or other regional actors, it may be a barrier to the adoption of digital health, frankly, in the very areas where it would most benefit people because of the ability to do telemedicine and do remote delivery of care in some cases. We will be examining these issues as well as many others in future discussions on digital health.